What turned Dorothy Spourdalakis, a loving mother, and Jolanta Agatha Skradska, a loving godmother, into killers?
Mother and a caregiver head to court this morning, charged in the death of a 14-year-old boy.
More details about the death of a teenager with autism. His mother and godmother
face murder charges in connection with the stabbing death of 14-year-old.
Prosecutors called it a cold, calculated, and premeditated murder mapped out over the course of a week.
In February 2013, the Autism Team, a group of professionals dedicated to treating autism, received a plea for help on behalf of a sick and severely affected child, a 14-year-old boy in 4-point locked restraints in a Chicago hospital. A boy being treated, in the words of witnesses, like an animal. What followed is a story of our time, a tragedy, one of an antiquated and failed perception of autism as a psychiatric condition, one that has blamed bad parents and bad genes, that sees autism as irreversible, amenable only to damage control with restraint, locked doors, electrocution, and psychiatry's panacea of mind-altering drugs. A perception now challenged by a new and vital view of autism as a medical condition, one that for many can be understood, treated, and ultimately prevented. But not in time for Alexa Spourdalakis. Alex was a healthy baby. His early medical records document normal development to 18 months.
Everything was normal. APGAR scores of 10 and 9, I think 1-8 maybe. He met all his milestones, did what he was supposed to.
Everything completely as normal.
Yeah, he was eating right, he was sleeping right, yeah. Everything was fine with him.
Agatha, Alex's godmother, had trained as a doctor in Poland. She had been with Alex and Dorothy from the beginning.
He was babbling, saying the vowels, the mama, the dada, the baba. All the usual, the first sounds that the child makes.
Alex was a typical, inquisitive little boy. Suddenly, at 18 months, it all changed.
Yeah, he developed a fever, he started screaming, especially at night. He would spend most of the night awake. You know, all kinds of issues started.
He had that episode with the fever and the screaming at night. And that was like a turning point.
He lost his speech, strange behavior, skin rashes. Then we'd get the diarrhea.
The eye contact was not there. You would try to talk to him and make him to look at you, and he would just not.
At around 3 years, Alex was diagnosed with autism. He was severe, nonverbal, and completely dependent on Dorothy and Agatha. Although Dorothy's husband Minas continued to share their family apartment, any semblance of a normal life for the Spourdalakis family was at an end. Significantly, at the same time that he lost his skills, he developed intestinal symptoms. And in a pattern familiar to many autism parents, Alex stopped sleeping and craved certain foods.
He did crave dairy, milk
2 gallons a day.
Loyola Hospital pediatrician Dr. Rebecca Turk was initially resistant to testing Alex for food allergies.
I got a phone call that said, "I'm sorry, you're right." RAS profile came back positive. Now, Dr. Anik Gay, she was a pediatric allergist immunologist. She took a look at my son, took a look at his skin, and she says to me, "It's okay. I understand.
And we will figure it out."
And we will figure it out. And she basically saved his life.
Under medical supervision, Dorothy cut out the foods to which Alex was allergic.
We went home, threw out everything that was open. If our friends didn't want it, everything that was wrong, we donated to a food bank. Because of the fact that you can't cross-contaminate. You can't have people at home eating what he can't have.
It wasn't easy, but it was worth it.
Within a week, the head banging disappeared. Within a month, the skin rashes resolved themselves. They just disappeared.
And the bowel issues?
Stopped.
Direct medical observation confirmed improvement in his symptoms.
Well, he was a different child, totally different. And he was on this diet for over 7 years.
Dorothy and Agatha had recognized the link between Alex's autistic behaviors, his intestinal problems, and food allergies. Entirely on their own initiative, they had brought Alex to a much happier place.
Want this one and one more. There you go. Check this out, buddy. We is on top of the world. I'm coming. And where you going? We gotta check it out. Let's go check it out. Come on.
Alex loved the open air.
And there goes my manfish.
He would swim whatever the weather and loved to hike the dunes along the southeastern shore of Lake Michigan, which is where his relationship development therapist, Amy Lucas, first met him.
Alex was not in school. He hadn't been in school for over a year due to the inability of the district to find proper placement. So my first role was to help the family get Alex in a proper school placement. He seemed to be a very smart kid.
You rock star.
When I first saw Alex, I did not think there was any severe medical needs. I didn't think he was in any pain.
But all that was to change. On the basis that some children grow out of food allergies, at the age of 10, his pediatrician recommended reintroducing the foods that had previously caused him problems.
The pediatrician that he was going to said, why don't we introduce regular...
Children grow out allergies, food allergies. He might have grown out his allergies. So why don't we start reintroducing foods one at a time and see what happens?
Nothing happened immediately. But by the summer of 2012, at 13 years of age, his symptoms reappeared.
This started last year, late spring.
Late spring, and it started really
going
slowly, slowly creeping up again, slowly. It started with the irritability, not being able to sit still, constantly on the move, like an Energizer bunny.
He couldn't focus. He had trouble doing things that he normally would do. You know, the person that we knew up until now that was level, but something was wrong.
The medical solution?
So they put him on Zoloft.
If Alex's previous experience with drugs such as Valium, Ritalin, Midazolam was anything to go by, Zoloft would only make things worse.
He was wired more than without it.
Zoloft can, and allegedly did, markedly worsen Alex's agitation.
That's when the nightmare started. As it started to get darker, he'd get extremely agitated, very agitated.
And that's where the sleep issues...
The sleep issues started because he would be sleep deprived, couldn't fall asleep.
So he would stay up till 5 o'clock in the morning, sleep 2 hours, and then he would want to still do stuff during the day. But if you sleep 2 hours a night, So after the third or fourth night of 2 hours of sleep, eventually you are so agitated that you're gonna lash out at anybody. And we called paramedics, and they take him to the hospital.
On November 15, 2012, Alex was taken to the ER of Gottlieb Hospital in Melrose Park, Illinois. The medical solution? A powerful tranquilizer, haloperidol. Michael Wasaki, Alex's respite worker and a family friend, describes what happened next.
They gave him, I believe, Haldol, and it nearly killed him. His whole body froze up. He couldn't move for about 8 hours.
Alex suffered a severe reaction associated with prolonged painful muscle spasms. Blood tests confirmed the damage done to his muscles by this reaction. Another drug, another serious reaction. The medical solution, 2 further drugs, Ativan or lorazepam, a tranquilizer, and Cogentin or benztropine, a muscle relaxant. In order to get a higher level of pediatric care, Alex was transferred to Gottlieb's sister hospital, Loyola. This higher level of care included prescriptions for intramuscular chlorpromazine and Zyprexa or olanzapine, both antipsychotic medications. As far as Loyola was concerned, Alex was headed for inpatient psychiatric care.
They treated Alex as if he had just autism. In other words, they looked at his condition, his behaviors, as psychiatric.
And despite Dorothy's conviction that his problems were medical, not psychiatric, he was transferred to Streamwood Behavioral Health in Streamwood, Illinois on December 3, 2013. Another hospital, another drug, this time clonidine, in an effort to reduce his marked anxiety. His medical records describe Streamwood as a very negative experience. He stopped eating and wearing clothes, spending most of his time in the isolation room. But at least the drugs had achieved their desired effect. Dorothy was heartbroken.
And I remember when she came back in the car, she was just crying because she says, "Why did I put my son in here?"
Predictably, clonidine wasn't without its problems, causing a severe skin rash which required treatment with another drug, Benadryl. Amy Lucas intervened on Alex's behalf.
I talked to Streamwood, told them that this was not psychiatric behavioral. So they then released Alex after doing a couple different tests and failing to help him.
Long-term institutional care was not the right option for Alex, which, in addition to all its other problems, had created a marked separation anxiety. He needed those who loved and understood him close by. Alex also desperately needed a doctor to pay attention to the reason for his deterioration over the previous months. The key is to recognize how Alex and children like him communicate pain and distress, often with self-injury and aggression towards others.
Charlie, don't you dare, don't come out.
No,
don't come out. Don't.
Please don't.
One Gottlieb doctor, Dr. Sublad, was later to capture this in Alex's records. He is nonverbal. He communicates with some of his own signs. His long-term therapist, Amy Lucas, also got it.
I was at school with Alex one time, and it was on a Monday. Alex had gone sledding with his mom and Agatha at the dunes. And Monday morning we went into school. I was walking with him, and we were going to go up a set of stairs to go to his classroom. And he turned around and he sort of lunged at me and got me in the corner. And I said, "Okay, Alex, wait, okay, you don't have to go up the stairs." I sort of knew that there was something wrong because it's not something he would normally do. We found Mom, she brought him home, took him to the emergency room, and his foot was broken, and that was from sledding. So that's an example of Alex being in pain and then trying to tell you he's in pain. He had no other way of communicating. So it came out as a behavior.
And he needed doctors to recognize that psychiatric medications were having consistently harmful effects. Despite some happy moments in the final weeks of 2012, as night fell, his agitation would return with a growing intensity as his condition became more precarious with each passing day. On the night of January 24th, Alex's behavior deteriorated dramatically.
At about 3 in the morning, Alex was so overtired. Alex almost pulled the whole dresser down on himself. And then he just went on a tirade in the house. Then it was just 7 minutes. To me, it was like just terror. It was, he just pulled all the ceiling fan fixtures. Glass was everywhere. He almost pushed Agatha down the stairs. He almost pushed Dorothy out the window. He kicked Dorothy in the hip. Dorothy went down. She managed to get into the bedroom and call 911. There was no exam made. It was just as if he was, like I said, a DUI or somebody being brought in to detox.
Eventually, he was seen by a psychiatrist, Dr. Borden.
He came in and he asked Dorothy what medications he was on. She told him. He was going to prescribe something that he was already allergic to. Dorothy had taken the bag and she says, "Doctor, he's allergic to that." He said, "That's ridiculous." This doctor, I think, was going to prescribe or give something that was in that bag of do not takes. 20 minutes later, a person from DCFS came to visit us and said that the doctor had made a call to DCFS saying that Dorothy was neglecting Alex's medical needs. Dorothy got very upset. She broke down. "I love my son and there's no way." And then there was another doctor that calmed her down.
DCFS were called off, and they all eventually decided that Alex was better off at home. Everyone, that is, except Alex.
We were driving from Gottlieb. We were heading to Grand Avenue, where, blocks from where they lived. At that point, Alex went berserk. Dorothy was driving. I was in the back seat, and Agatha was on the other side. At that point, Alex took his foot and he kicked Dorothy full on into her head. Her head hit the steering wheel as she was driving. She almost hit an oncoming car. Then he proceeded to bite Agatha in the arm into the shoulder. So I was grabbing Alex's leg, keeping him from kicking, trying to hold him back from biting her. And at that point, I said, "Dorothy, we got to take him back."
Yeah, they're coming, honey. Okay.
While in Gottlieb ER, one doctor listened to Dorothy's concern that there may be an intestinal cause for his distress and arranged a CT scan of his abdomen. Perhaps to the doctor's surprise, the scan showed abnormalities indicative of colitis or inflammation of the colon. Plans were made to transfer Alex back to Loyola for specialist care of his possible colitis. A Loyola X-ray doctor confirmed the appearance of colitis, but dismissed it on the basis that Alex had no other typical symptoms. This doctor did not appear to get that symptoms of abdominal pain in children with autism are not typical, not the same as developmentally normal children. An allergy specialist also confirmed that Alex's behaviors could be caused by foods, and a blood test confirmed that his food allergies were back with a vengeance. But Loyola's chief nursing executive allegedly stated that they had a different philosophy on the reasons for Alex's behaviors, and once again, drugs were the order of the day, including valproate or Depakote, an anti-seizure medication, Alex didn't have seizures, ondansetron for nausea, and oxazepam, another tranquilizer. Ignoring Alex's gastrointestinal or GI issues once again, doctors determined that he needed to be in a psychiatric hospital. After her experience of Streamwood, Dorothy had every reason to be worried that she was about to lose him permanently. But she clearly wasn't coping, and despite her reservations, she followed doctor's orders. The next 36 hours were chaos, starting with a 2-hour drive north to the nearest facility that would accept him, Lakeview Mental Hospital in Wisconsin. But before the day was out, Lakeview staff realized that they too couldn't cope. In what was described as a panic, and apparently without seeking his mother's permission, they shipped him off by ambulance to the emergency room of St. Mary's, Racine. Alex was already on his way when Dorothy, staying in a local hotel, was informed. Dorothy arrived at St. Mary's Hospital only to be confronted by medical staff alleging that she had abandoned her son. The local sheriff was called, and a custody order was issued. Alex was transferred to the State Mental Health Institute in Oshkosh. The following day, a judge returned Alex to his mother's care. At 10 p.m. that night, bewildered and exhausted, they eventually headed back to Chicago. Restrained in the ambulance, Alex was starving and unstable with his medication out of control. Arriving back home at 2:30 in the morning, it took 8 policemen and 2 paramedics to get him upstairs. And within a matter of a few hours, it fell apart, starting with a thrown iPad, a ceiling fan ripped out, and a violent attack on Agatha. Like a scene from the movie Groundhog Day,
we're back at Gottlieb, the place that we don't want to be, because it's like a dungeon. Back in restraints. It's just heartbreaking to watch.
Alex was to remain in Gottlieb's ER for 12 days. The hospital wouldn't admit him, and no one else wanted him. Dorothy and Agatha stayed by his side, sleeping each night on the floor beside his gurney. The hospital insisted that his problems were psychiatric, but when they tried to transfer him, no psychiatric facility wanted Alex. At this stage, a further anti-seizure medication, trileptal or oxcarbazepine, was added to his list of prescribed drugs. A drug for a condition he did not have. Psychiatrist Dr. Borden seemed concerned that there may be a missing medical cause for Alex's behaviors. This did not deter him from adding regular Zyprexa to Alex's prescription and increasing his dose of Depakote. Borden noted Alex's drug reactions, including psychosis and severe dystonia. Despite this, like a broken record, when Dorothy said no to further antipsychotic medication for Alex, Borden urged that her parental rights be removed so that these drugs could be given. True to form, Alex's Depakote had to be stopped 3 days later because of pancreatic damage. At this point, on February 24th, a whistleblower, a senior healthcare worker from Gottlieb, increasingly concerned at the boy's restraint and lack of treatment, contacted Gina Reed from the autism advocacy organization Autism is Medical, AIM.
I received a call from a friend who was a healthcare professional that was looking for support for a patient that was in desperate need of 1, support for the mom, and 2, medical care that they were not currently receiving.
The mother of a boy with autism and intestinal inflammation, Reed recognized Alex's symptoms immediately. The following day, she enlisted the help of Jill Rubelino, a very experienced nurse and the mother of a boy with autism who had benefited greatly from the treatment of his underlying intestinal disease. Rubelino listened closely to Alex's story.
He had other GI symptoms that were causing him this tremendous belly pain, and that is really where his behaviors came from. The child was in 4-point restraints, and by the time I was called, that had been day 10. And I was horrified by the scene. It was extremely adversarial. He was definitely in a situation that was not appropriate by any means.
Toward the end of his time in Gottlieb ER, 2 things happened. For reasons that are not clear, Alex was prescribed topiramate. topiramate, notable mainly for its list of side effects, is licensed as an anti-seizure medication. At the risk of sounding repetitive, Alex did not have seizures. Second, an adult gastroenterologist, Dr. Spourdalakis, saw Alex, recognized the clear need for GI investigation, and planned to perform an endoscopy, a visual examination of the lining of his stomach and upper intestine. He wrote, "There have been several weeks now where he is much worse and agitated and unable to eat because of abdominal discomfort." He continued, "Mother seems to be at her wit's end." He also noted that Loyola didn't want Alex back. Nonetheless, they were about to get him. Concerns about lack of pediatric anesthesiology at Gottlieb led to an arrangement to transfer Alex to Loyola for his GI investigations. Present when medical staff discussed their plans for Alex, Rubellino is very clear about the reason for Alex's transfer to Loyola.
The physicians at Gottlieb were able to facilitate a transfer to Loyola specifically for the endoscopy to be performed with the assistance of both pediatric GI and pediatric anesthesia.
He gets transferred to Loyola. Nothing.
We wait.
We wait. Restraints, drugs, more drugs.
After a week, we finally get to see a GI specialist.
I think his name was
Dr. Hernandez.
He came into the room and advised the mom that he had 5 minutes. He reluctantly listened to parental history, did not examine the child, and left. That was his consultation.
The following day, another gastroenterologist, Dr. Garcia Alvarez, came to see Alex. In her opinion, Alex clearly needed extensive GI investigation.
We were so excited when we showed her a list of symptoms and we presented his history, his food allergies from before, and all of these different GI issues. This woman agreed not only to an upper GI, but she said he needs a lower GI. She gets it. She gets it.
She went ahead and ordered both an endoscopy and a colonoscopy. But Dorothy, Agatha, and Dr. Garcia Alvarez had reckoned without Dr. Berman, Loyola's chief of pediatric gastroenterology.
The head of pediatric GI came in with a whole bunch of other people and said, there is absolutely no need for any GI procedures.
For now, what he said was that there might be a GI issues, but they are secondary to the psychiatric issues. That's what he said. Secondary to the psychiatric issues. And if you heal the mind
will heal the body.
The rest is gonna follow.
Right.
Wow.
They would first heal the brain, and the brain would heal the body.
And I get this, do you get it? Do you get it?
He actually did that to you?
Yeah, from across my son's bed.
We were speechless, because after being ecstatic for 2 days, we got our hopes crumbled.
Very, very bad news. Dr. Berman, head of Peds GI, has informed me that the GI issues will not be pursued.
Did you see Dr. Garcia again?
She came in a day later, and she repeated the same thing.
She couldn't make eye contact anymore.
And she
explained everything.
She said what she had to say and just left the room.
Dr. Garcia has been put in her place.
But Reed and Rubellino refused to give up.
I decided to bring a stack of literature articles. Dr. Krigsman's article was on top, an AAP article was on top that talked about bowel disease in children on the spectrum.
The medical team at Loyola even received a call from Dr. Bowie, a GI autism expert from Boston Children's Hospital, endorsing the mother's concerns. By this time, AIM had filed requests for help or official complaints with the Office of Civil Rights all the way up to the state of Illinois and every relevant body in between. A statement issued by AIM declared,
"We are sickened by the lack of anything that resembles adequate or appropriate medical care."
Anticipating the worst, the statement continues.
"This gross display of negligence is endangering this child's life."
Disgusted, Rubelino expressed her view of Loyola's position.
"Let's drug him into oblivion and get him out because the mom isn't cooperative with our complete lack of anything resembling the practice of medicine."
She continued,
"I would be ashamed to be associated with this organization."
At this point, Reed contacted autism mom Lisa Goes, a resident of New Lenox, Illinois, and a contributor to the daily news blog, Age of Autism.
She contacted me because at that time, he had been in restraints for 19 days, and there was no alarm, there was no concern in the medical community that was caring for him that this was the case.
Goes called Dorothy and headed over to Loyola.
In talking to her, I kind of had an expectation. It didn't even compare to the reality of seeing a human being being treated like an animal. The Age of Autism was kind enough to break the story. It went viral on the internet. I placed that same call to action that I did with the autism mothers for Loyola. I placed that same call to action and said, I want you to call the press. So we all called our local papers, we contacted every single media outlet that we could think of, and it was met with absolute silence. And at one point I contacted James Kirk, who is the senior editor at the Sun-Times. And we went back and forth a couple times and it got heated, and I said, I don't understand, if there's a child who's been tied up and he's still in that hospital, what would make you think there's not a story here? He yelled at me and he said, what the hell do you want me to do?
I'm helpless. The system won't help me help him.
Claims of neglect and mistreatment. A mother says a local hospital restrained her son and left him to suffer, all because he has special needs.
They just decided that he has to come out of the restraints right after she did the interview. They want him out of the restraints as in within 15 minutes.
Yeah, and they could have done it before. There was no need to restrain him.
They kept saying that medically he is cleared. There is no medical issues.
Just psychiatric.
The autism team was contacted by Dawn Loughborough, particularly to help resolve Alex's continuing gastrointestinal problems. The expert opinion of the autism team's Dr. Arthur Krigsman was sought. Dr. Krigsman has seen and treated intestinal disease in thousands of children with autism and was all too familiar with Alex's story. Armed with a clear history of Alex's distressing symptoms, plus the opinion of successive gastroenterologists, Alex, with his mother, godmother, and carers, was driven through the night of April 2nd to see Dr. Krigsman in New York.
The sad reality, there is no help in terms of having someone sit down and look at things with you. They assume it's psychiatric. The mind here heals the body, is what I was told.
Once he's sleeping, we'll send you out of the room. And we are then going to first do the colonoscopy. We'll get biopsies, which are tiny pieces of tissue, about 1 millimeter in diameter, so they're really small. At the end of the endoscopy, we are going to place the pill cam, the capsule endoscope. It's manufactured by Given Imaging, and it's a remarkable device. It takes 2 photographs per second as it moves down the full length of the small intestine. The capsule endoscopy is essentially a totally safe procedure if your patients are chosen properly. And what this does is it gives us a magnification ×8 of the lining of the bowels.
Okay, what can I finish?
One simple clue to an autistic child's underlying intestinal disease is the dramatic improvement observed during bowel clearance the day prior to colonoscopy. As predicted by Dr. Krigsman, Alex slept soundly for the first time in months. For 14 hours, in fact.
Really quietly, because Alex is asleep. He's very calm and comfortable, and we're doing it like this, literally because we don't want to wake Alex up.
Right. Because this is the most comfortable we've seen him in months.
Yeah, he's sleeping like a baby. He's snoring away.
That's right. He fell asleep around midnight, 12:30, and he just got up at 9 o'clock, 8:30 for just to use the bathroom and went back to sleep. Hi, good morning. Did they say good morning to you?
Hey, he's smiling.
Yeah. See the difference?
The moment of truth had arrived. Were Dorothy and Agatha's suspicions correct?
You're okay, Alex.
Whatever you need me to sign, I'll sign. I'm just trying to keep God here.
Is that hemorrhagic lesion?
Okay, Anna, you can go ahead and eject.
Ready?
Go ahead. And retract it now. Perfect.
He has the inflammatory bowel disease that we see in children with autism. His stomach is studded with these lesions, these ulcers, these small, tiny ulcers. And there were too many to count. Numerous ulcers. We have photographs of this. Once you leave the stomach and get into the duodenum, the first few inches of the duodenum were very inflamed as well. Also with enlarged lymphoid nodules. So that seems to be the pattern. There's enlarged lymphoid nodules. And so he has a duodenitis as well. And then at the very end of the ileum, he had very marked lymphoid hyperplasia. So you've seen probably photos, the markedly enlarged lymphoid nodules that we see in the ileum of these children.
You're very welcome.
You were good.
Thank you.
You're a tough chick.
We have a tough boy on our hands.
It was home to Chicago. Arriving back, they had a problem. Sirens, flashing lights, reminders of police, hospitals, and traumatic separations. Dorothy's texts tell the story.
Last night coming into Illinois, he heard an ambulance and freaked out, ripped his clothes to shreds. Yesterday, 2 run-ins with ambulances. Alex is scared shitless he's going to the hospital. He thinks they're coming for him.
And going near home caused Alex real anxiety.
He associates his old home with ambulances and police, more trauma.
The 3 of them were to start a nomadic journey from hotel to motel, trying desperately to hold it together as they awaited the final results from Dr. Krigsman.
I dread the nighttime, as that is when Alex is noisiest.
And inevitably,
If people complain again, they will either call the police or ask us to leave. Left the hotel room. Alex had a panic attack. Ripped clothes. This is falling apart. I'm really at my wit's end. Agatha and I are ready to fall over. We are exhausted, no place to run, have no clue what to do next.
And ironically, Dorothy noted that
Because he cannot take antipsychotic drugs, no psych place will accept him.
in the meantime, Alex's GI test results were now in, including his capsule endoscopy study. Alex's small intestine was swollen and studded with more tiny ulcers. Dr. Krigsman started him on the appropriate medication for his intestinal inflammation. But almost immediately, Alex was to be taken down a new and dangerous path. In order to comply with the Loyola care plan, Dorothy was required to consult with a psychiatrist. She went to Dr. Best of the Neuroscience Center in Deerfield, Illinois.
I first came to know about Dr. Best in general after Dorothy had returned to Chicago from New York after the endoscopy. And we were discussing what plans there were to treat Alex for his inflammatory bowel disease. And Dorothy indicated that she had seen Dr. Best and that he had made a different diagnosis and wanted to treat Alex a bit differently, and that Dorothy was torn on how to proceed from there. Dorothy did tell me that Dr. Best had strongly discouraged her from treating inflammatory bowel disease, and he steered her away from that diagnosis. She told me that Dr. Best had given her a diagnosis of Lyme disease.
Lyme's disease is caused by the bacterium Borrelia burgdorferi, carried by deer ticks. It seems that Dr. Best also diagnosed Alex with a second infection, cat scratch fever or Bartonella.
A dual diagnosis, and for reasons that I'm not clear about, she decided, she was convinced that that was the accurate diagnosis. He recommended antibiotics, multiple antibiotics taken in quick succession. So I called Dr. Best at her request, and I asked him the basis on which he made the diagnosis of Lyme disease. And what he answered me was a little bit surprising. He said that, well, Alex had a rash, and he lives in Chicago.
And what did you say to Dr. Best?
I said I'd never heard of those diagnoses being made on geographic location, and he assured me that he was making a diagnosis based on CDC criteria.
In fact, the Centers for Disease Control recommend 2 blood tests before considering treatment for Lyme.
Dorothy and I spoke on the phone, and I told her that I was very, I wouldn't even use the word skeptical. I told her I disagreed strongly with that diagnosis, and that there was a good chance that giving Alex a course or multiple courses of antibiotics, given the state of his inflammatory bowel disease, may in fact make it worse.
And what did she say?
She was crying because she was torn, and at that point I think she was just so emotionally distraught that the idea of a 2-week or a 4-week course of antibiotics that would cure Alex of his severe pain and aggression and self-injury, just that thought was so seductive and so hopeful to her, and she wanted it so badly that she chose to do that.
It was a few days into the second round of antibiotics, a drug called Augmentin, that has frequent intestinal side effects, that predictably, Alex crashed. By mid-May, Alex had become unmanageable. Beyond exhausted, increasingly desperate, and unable to cope any longer, Dorothy and Agatha took him to Elmhurst Hospital emergency room. Elmhurst doctors considered it necessary to transfer him to the Pediatric Intensive Care Unit of Lutheran Hospital in Park Ridge, Illinois, which is where the autism team caught up with him again in late May for the last time.
Can they not take his restraints off at all? No. But is that hospital orders? No, he doesn't want it, does he? That's not like Alex. And do you think it's could be to do with all the drugs he's on?
Maybe.
Trying to find.
Maybe.
Do you spend all your days sitting in here?
Yeah. Where else are we going to be? This is the only place.
One of us walk out of the room.
Paradoxical reactions.
So you're here 24/7?
Yeah. He asks about the one that's gone exactly every 30 seconds.
So you guys, both of you two need to be here?
Yeah.
All the time?
All the time, and then we just go.
Exactly the opposite of what the drugs meant to do.
Yeah.
And where do you sleep on that sofa thing?
What do we sleep?
Just here?
Yeah. Here and here. The minute we pulled up into the emergency room parking lot, he quieted. The nurse came out with the wheelchair. He let the nurse put the gown on. He sat down in the wheelchair, and there was no problem with him in the emergency room. It's like he knew
that he needed help.
That going to some place when he's not well.
It's not cancer.
The women were terrified of the consequences of being separated from Alex.
Are they not going to let you be with Alex? You can't be with him?
The psychiatric facility.
No, you can't. We can't do that. He's going to be scared out of his mind.
Well, it's the only choice I have. I have nowhere else to go. That's how it's going to be. You do not stay with kids in a psych unit, and if you're lucky, depending on which one, they tell you you can't see them for the first 30 days. That's right. And this is what he's fought for and hung on all this time to have this happen. And if something doesn't change between now and Tuesday, it's over. Once they separate,
Lutherans' doctors appeared to ignore evidence of Alex's underlying medical condition, apparently making no effort to contact Dr. Krigsman, but they still had a chemical kosh or two to hit him with. Intravenous lorazepam, Precedex, an intravenous sedative, and intramuscular ketamine, an anesthetic and powerful hallucinogen. He had developed a rash all over his body and stopped eating or drinking.
And we kind of figured it out with the medication. Within 20 minutes or so, he got aggressive. The worst moment that we had was they kept increasing his dosage of Ativan. It was as if I was looking at an exorcism needed to be performed. He was possessed. He was kicking, and he was tied down in his feet, and he was kicking, and he bent the metal weld on the bed frame. He bent it about this much with all his might. And at that point, there was about 8 nurses and doctors standing there looking at him like we were watching The Exorcist.
Like Dr. Frankenstein, all the medical staff could do was stand and stare at what it was they had created.
And Dorothy says, "This is what you call help?"
There's no hope. He's suffering the unimaginable.
To Dorothy and Agatha, it was now inevitable that Alex was headed into the endless nightmare of permanent psychiatric care.
Putting him in a psych facility and chasing him around the room with syringes, that's not the answer.
Going to psych hospital when they find appropriate placement.
Incarceration, isolation, restraint, drugs, and more drugs.
Nothing like looking at your child not knowing when you'll be together again.
But once again, nobody wanted him. It seemed that no hospital or psychiatric facility wanted young Alex Spourdalakis. The most alarming news was yet to come.
No place will take Alex. Insurance says we have to leave. We're going to leave this afternoon. Don't know what will happen.
It was in fact Lutheran Hospital that said he had to leave, and on the last day of May, they delivered on their threat. In anticipation, Alex had allegedly been weaned rapidly off intravenous and intramuscular medications, which were replaced by another drug, Invega, or paliperidone, a drug for schizophrenia, another diagnosis that Alex didn't have. And despite the fact that restraints were still considered necessary in the hospital, Alex was put out on the street. Discharged from the hospital in which he had been born. The Emergency Medical Treatment and Active Labor Act, EMTALA, requires hospitals to provide emergency health care treatment to anyone needing it, regardless of ability to pay. Hospitals are prohibited from discriminating against or providing substandard care to those who exhibit signs of mental illness. They may not discharge patients needing stabilization or when their condition requires transfer to a hospital better equipped to administer the treatment. The hospital had him in restraints in the pediatric intensive care unit. They determined that he needed powerful drugs to sedate him and transfer to a specialist psychiatric facility. Lutheran Hospital closed its doors on Alex at a precarious time with the Spourdalakis family in a very vulnerable state, medically, emotionally, and financially. 1 week later, Alex was dead. After leaving Lutheran, Dorothy and Agatha had no option but to return to the family apartment, requesting that her husband and daughter move out, returning only to shower and wash clothes.
It's bad. Alex can't go anywhere. He has a fear of the outside. When he's home, he wants to go out. When he leaves the house and crosses a threshold, he goes nuts.
Dorothy's last text to Michael said,
"Catch up later."
They never did. On June 9th, Minas returned to a silent apartment. The following day, it was still unusually quiet. The door to Alex's bedroom was locked. Fearing the worst, Minas called in Dorothy's brother, Ski, an ex-Marine, who kicked in the bedroom door and discovered Alex dead in his bed. Dorothy and Agatha were lying unconscious at his side. Alex had been given an overdose of his own medication. Ironically, despite his multiple serious adverse reactions to psychiatric drugs, in overdose, they had failed to kill him. Alex died from a knife wound to the heart. In her statement to the police, Alex's sister, Vasilia, described her mother's wish.
Whenever he goes, I go. Whenever he dies, I die.
A wish that was not to come true. Their attempted overdose failed, and under police guard, Dorothy and Agatha were taken back to Gottlieb Hospital. They were arrested, confessed to killing Alex, and eventually transferred to Cook County Maximum Security Prison.
Michael, what plea have you entered?
We've entered a plea of not guilty.
We have entered a plea of not guilty on behalf of Jolanta.
There is one final twist. The relentless specter of medication was to make a further appearance. The autism team learned that Dorothy was taking an antidepressant.
Agatha was telling me of her concerns that she's just not herself, and she had told me that she was on Lexapro.
Lexapro, a type of drug with the side effects of suicide and violence.
And Agatha says, well, it's making her crazy.
The team was also informed that Dorothy's husband, Minas, apparently obtained this drug for her from Greece. In the final few weeks, she had been taking Lexapro erratically. The sudden withdrawal of this type of drug is hazardous and can lead to dramatic worsening of psychological symptoms.
I believe that Dorothy had acted unknowingly, without intent, that she did not appreciate the criminality of her conduct.
This factor could be highly significant in Dorothy's defense, an insanity plea based upon an adverse drug reaction.
There are a lot of indications in this file that insanity is an appropriate defense. And I think the public should understand that she did not act rationally. She was so confused, tired, depressed, overwhelmed by the situation, and she knew that there was no future for Alex. No one was there to help her.
Significantly, however, the events of June 9th included more than just the discovery of the crime scene. Dorothy's brother described how Minas removed any trace of his wife's Greek antidepressant medication from the family apartment, thereby depriving the defense team of what might have been a vital piece of evidence. Minas declined a request for an interview. He has not denied his brother-in-law's version of events. Which leaves one vital piece of this puzzle. What causes a normal, healthy child of 1 to regress into autism? A child whose life was over in so many ways from the age of 18 months.
When things started to go wrong, when they kept giving him the shots as scheduled, and when they gave him his group of shots, part of which were the MMR, that's when party started.
Their story of what caused Alex's regression has been consistent throughout, from Dorothy's refusal to give him any more vaccines after his 18-month reaction, through to Dorothy and Agatha's confessions to the police 12 years later. Alex's vaccine reaction is consistent with and occurred within the required time frame for brain damage that is set out in the U.S. government's vaccine injury table.
And that was like a turning point. The eye contact was not there. You would try to talk to him and make him to look at you, and he would just not.
Alex's reaction and his developmental regression into autism is very similar to that of children with an autism spectrum disorder compensated by the government's Vaccine Injury Compensation Program, NVICP. In cases conceded, not just fought and lost, but conceded by the government. A recent analysis indicates that, unknown to the public, there are many more such cases that have been compensated over the past 30 years. We will never fully come to terms with the death of Alex Spourdalakis and the growing list of children like him.
The 36-year-old mother admits to holding her son down and drowning him in the bathtub before trying to kill herself.
News since 6 o'clock, we have pictures to put a face to the mother charged in the death of her 25-year-old son.
The Carmel Valley mother was sentenced to 15 years in prison today for drowning her 4-year-old son.
Funeral for an Irving toddler strangled, allegedly at the hands of her mother, is set for today.
She's charged with the unthinkable, murdering her own children.
Both are what, dear? Autistic. They're both autistic?
Daniel, who had just turned 4, was diagnosed with autism. Daniel's aunt said this. Daniel is asking, "Why, Mama? Why did you kill me?"
If not for Daniel, then at least for Alex, one can begin to fill in the blanks.
Autism, for some reason, like no other condition, creates this aura of fear and uncertainty in many, many doctors. And what they do is resort to the failed legacy of psychiatry, psychiatry's misguided past of what autism is and its candy-coated present.
Medical records and forensic reports indicate that Alex had been prescribed at least 25 psychotropic drugs. Panacea or illusion? Good medicine or accomplice to alleged murder? Seemingly, however, the only trick up the psychiatrist's sleeve. Was Alex the victim of a hate crime, as alleged by the National Council on Disabilities and some autism self-advocacy groups?
I think, an ideology, a dangerous ideology that preaches that people are better off dead than disabled, is what led to Alexa Spourdalakis' murder.
People that believe that Dorothy acted out of hatred or believe that this is a hate crime are half-baked. They don't wear Dorothy's shoes. So this is absolutely a foolish statement to say it's a hate crime.
In clinical medicine, there is absolutely no substitute for the clinical history and the physical examination of the patient. What actually happened to this child and what ails them now? And it's telling that the doctor who made the final decision on not to investigate the gastrointestinal symptoms in Alex never laid a hand upon that child.
In her suicide note, Dorothy had one last message for Dr. Berman.
Tell him that he will never neglect Alex again by denying him treatment and necessary testing.
Interviews were requested with Dr. Berman, Dr. Garcia Alvarez, and Larry Goldberg, the chief executive of Loyola Hospital, so that their sides of the story might be represented. They did not take up the offer.
The fact that Alex received a diagnosis of Lyme disease and was treated for Lyme disease with multiple antibiotics that directly led to an acute worsening of his gastrointestinal condition, that is completely unacceptable.
And then at a critical phase, at Lutheran Hospital, when he was highly vulnerable, he was put out on the street, apparently because insurance had run out.
The offer was made for the autism team to help Loyola Hospital develop a management plan for dealing effectively with medical problems in children like Alex. The offer was ignored.
So what this experience has taught us as the A-team is that we desperately need recovery homes for people like Alex to go to get better. We believe that if Alex had had this, then he would more than likely be alive today.
You know, whether or not Alex were treated differently by Gottlieb or Loyola, or for that matter, other people, whether or not we would be here talking about Alex in past tense, I don't think so.
I'm going to hold mommy's hand, okay? Hold mommy's hand, oh yes. Rah, 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 yeah, my little Uber truck. Yeah. Right. Mommy's little fuzzy face. Oh, goodness. Still some left? Did it eat everything? Okay.
Only your doctor can diagnose depression. Zoloft is not for everyone. People taking MAOIs or Pimozide shouldn't take Zoloft. Side effects may include dry mouth, insomnia, sexual side effects, diarrhea, nausea, and sleepiness.
GlaxoSmithKline agreed to pay $750 million to settle criminal and civil complaints that the firm knowingly sold 20 drugs that carried questionable safety. Among the drugs was contaminated baby ointment and an ineffective antidepressant.